I'll start a new domain, that is pharmacodynamics. Okay? Now, that part is a little bit was discussed before, right? At the first class, I said pharmacodynamics. Can anyone tell what is it? In small definition, in your own words. Yeah, what the drug does to our body. So basically, this term came from some, obviously, we medicos take our names from Greek or Latin. Okay. So pharmakon, that means drug, and the dynamics, this means movement or is action. Okay. Dynamics means what? If we say, let's remember your class 11 or 12, all of you must have read thermodynamics, fluid dynamics. So it's what the heat does to the molecules. What is heat actually? In the term of thermodynamics, is a movement, right? Here also, the effect of the drug by its movement to the various receptors, enzymes, channels, etc., cells, nucleus. So it's everything is discussed in this part of pharmacodynamics. Okay. So it's simple. If anyone asks you in Viva also, what is pharmacodynamics? You can simply say that what the drug does to our body. Simple. Okay? Don't make it any kind of confusing big definitions. It has a simple one-line definition, what the drug does to our body. Clear? Clear? Okay. We'll soon have a mock Viva test after this general or something has been over. Okay. So there we'll discuss regarding this. SGL or your tutorial classes. After finishing up each unit, this unit comes under which unit? General pharmacology. So after completion of general pharmacology, we'll have a small Viva session. Okay? Just making you ready for the ultimate exam. By the way, when your friends are coming, any idea? Approx? End of December. Okay. So they probably they will miss one session after that. Now here in pharmacodynamics, we mainly discuss two things. One is action and the effect by that action. Action means how and where the effect is produced, and the effect is a type of response produced by a drug. Can anyone elaborate in your common sense? Can anyone elaborate by using your common sense? These two terms. I'll make it just simple. Exactly, right. How the drug, this action term, it means that the detailed discussion of how any drug, or say drug molecule, it acts on the various parts of our body. Okay. Now, if you think about the anatomical fraction, it's mainly made of organs, right? But if you think of in a molecular level, because pharmacology deals in the molecular level, and that molecular level deals with the anatomical side or effects. Okay. So, the molecular level, our body comprises of what? Basically, on one cell. Okay. So, if I draw one cell, already drawn. So, broadly, let's take this. What is this? Not cell. Cell comprises of many things. Cell membrane, yes. What is this? It contains what? It contains mainly the DNA in pharmacological terms of it. So, drugs may act outside the cell. Okay, any drug can act outside the cell. Then on the cell, on the cell membrane, it contains what? Cell membrane पे होती है firstly receptors. सही है? सही है? Then channels and the membrane itself. Right? Pharmacological terms of factor. यहाँ पे forget about phospholipids, वो part हो गया. ठीक है. These three things remains in the cell membrane. Okay. Now consider your nucleus. Actually, inside the cell also, there are mainly enzymes, right? To control various biological reactions. In every moment, there are millions of biological reactions going on. In fact, by every movement is a reaction between the actin and myosin filaments, isn't it? Okay. And if you go deeper, there are lots more. Now, in the nucleus also, it contains receptors. It mainly called as nuclear receptor. Okay. So ये 3-4 जगह है जहां पे कोई ड्रग फंक्शन करेगा. Okay. And by the action of on these receptors or the sites, enzymes, channels, etc. on the membrane itself, the effect comes out. जैसे न्यूक्लियस पे सपोज फॉर एग्जांपल ले लो तुम्हारा से हार्मोन्स. ओके. एक हार्मोन का नाम बोलो. क्या? ग्रोथ हार्मोन. ओके फाइन. एक्चुअली मैं भी यही सोच रहा था. तो ग्रोथ हार्मोन क्या करता है? बेसिकली अगर एकदम बेसिक पे जाओ तो ग्रोथ हार्मोन्स दैट विल स्टिमुलेट सेलुलर ग्रोथ और सेलुलर डिवीजन. एकदम बेसिक. और भी बहुत कुछ अलग डिफरेंशिएशन एंड मेनी थिंग्स है. सिंपल लैंग्वेज पे growth hormone will increase cellular division or replication. How it carries through this action? Cellular division कैसे होगा? Cell division कैसे होता है? Yeah, meiosis, mitosis, but what is at this level? Nucleus के अंदर पे क्या होता है which causes this mitosis? Karyokinesis. Yeah, karyokinesis किस चीज का division होता है? DNA and replication of DNA mainly, and that replication induces various RNA and other things to form. Okay. So growth hormone काम करेगा इस level पे, nuclear receptor level पे. Whenever it will bind to any nuclear receptor, it will go inside the nucleus, and then there it will exert its various functions. Okay. Then कुछ drugs से हम लोग आएंगे बाद में धीरे-धीरे, अभी mix up करने की जरूरत है. So these are the sites of drug action. One is extracellular. One is cellular, means on the membrane, and little bit inside its cytoplasm, which contains enzymes, channels, etc. Okay? And then comes intracellular, or we can consider the intracellular includes this nucleus. Okay? तो एक्स्ट्रासेलुलर हो गया. मेनली यहाँ पे आएगा तुम्हारा फिजिकल प्रॉपर्टी. जैसे तुमने एंटासिड खा लिया. अभी बहुत सारा अभी इन्वाइटेशन है किसी का, बहुत ज़्यादा खा लिया. खाने के बाद क्या होगा? If you eat too much, what will happen? Indigestion, okay. And because of this indigestion, what happens? Acidity. So if there is acidity, what will take? Acidity होने से तुम क्या लेते हो? अरे सब लोग लिए हो भाई, come on. हाँ? क्या? पेंटोप. ये बात की बात है. पेंटोप्राजोल दैट विल स्टॉप द एसिड टू सिक्रेट. ऑलरेडी जो फॉर्म हो गए उसके ऊपर पेंटोप्राजोल का कोई फंक्शन नहीं है. डोंट मिस्टेक दैट. इफ एसिडिटी ऑलरेडी हैपेंड, पेंटोप्राजोल हैज नो एक्शन. एंटासिड, डाइजिन, जेलोसिल, एटसेट्रा एटसेट्रा एटसेट्रा. व्हाट इट डज? Antacid contains what? Antacid contains megalobate, magnesium hydroxide, aluminum hydroxide. These are what? These are basic compounds. So they will neutralize the acid. So if acidity happens, take antacid. To prevent acidity, जैसे invalidation पे जाने से पहले already pantoprazole खा सकते हो. एक बार acidity हो गया मतलब you can't do it. Pantoprazole won't do anything. Not anything actually, it won't do much. Then basically your antacid will come into function. Okay? So this is a simple physical property, a simple neutralization. So that is at the level of extracellular level. At the cellular level, there are various receptors, channels, etc. over the cell membrane. So this is the cellular level. Intracellular कहाँ पे आएगा? Cell के अंदर पे. It into cytoplasm and your nucleus. Okay. Now, principle of drug action. Now, this is an important short note. Okay. So basically, there are 5 principles in which drugs do act upon. Firstly, stimulation. Okay. Then again, inhibition or depression, replacement, irritation, and cytotoxic. Okay. Now, just one question, depending on the previous classes. Which type of drug will cause stimulation? Which type of drug will cause stimulation? सब भूल गए. Agonist. कौन बोला? Very good. Agonist. And obviously inhibition and depression that will be done by agonist का उल्टा क्या है? Antagonist. ठीक है. Replacement example. अब मुझे मेरे क्लास पे 70 स्टूडेंट्स चाहिए. तुम लोग 70 को अप्रोक्सीमेटली लेके चलते हैं. अब एक स्टूडेंट कभी ड्यू टू सम रीजन one student is absent. What I'll do? I'll replace him by another student, isn't it? Because मुझे 70 students चाहिए इस क्लास में. Now I gave you an example of replacement. Now tell you a pharmacological example of replacement. Exactly, deficiency. Say, let's say anemia, we have iron deficiency. So what do? We provide iron. If there is vitamin C deficiency, क्या होता है? Scurvy. तो scurviness हम लोग क्या करेंगे पेशेंट को? विटामिन सी रिप्लेस करेंगे. बेरी कहाँ पे होता है? विटामिन B1. तो हम लोग विटामिन B1 का रिप्लेसमेंट करेंगे. Okay. Have you heard the name of Parkinson's disease? What is this? Basic idea, huh? Yeah, CNS disorder जहाँ पे tremor होता है. तो in Parkinson's disease there is a depletion of dopamine store. So we provide dopamine in the form of levodopa. I hope all of you have come across levodopa. कहाँ पे? By physio में होगा I guess. Physio में ना? Physio में. ठीक है. So this is replacement. Means what is the body is deprived of, we are providing another that same chemical which the body is deprived of. So as a result, we are replenishing the stores or replenishing the level. Okay? That's why we are treating. Irritation. Example? Girls, have you used nail polish remover? स्किन पे लगने से क्या होता है? What the nail polish remover consists of? Say in short, absolute alcohol or isopropyl alcohol. Okay, the percentage is around 99.9% or 95%, depends on the brand and intensity of its action. Okay. So ये अगर स्किन पे लगेगा तो क्या होगा? क्या होगा? जलन होती है ना? बर्निंग सेंसेशन होता है क्या? होता है क्या? Suppose you have a cut injury. So dressing is going on. What will happen? There will be burning sensation. This is irritation, and that also is a part of treatment because that irritation is causing increased blood flow. So increased blood flow will cause what? It will be intense the healing process. Number one. Number two, also there is a term known as astringents. It actually increases your tensile strength of your skin. So instead of, in case of some anti-aging process, we use some astringents locally to make the person little bit younger. Because it will make your skin tan. Okay? Last, cytotoxic. मतलब toxic substances to the cells. Example? मैंने बोला था I think. Huh? Antibiotics, yes. These are cytotoxic to the organisms. And for human, if you can consider, chemo. सिर्फ chemo मत बोलो. Cancer chemotherapy बोलो. Because chemotherapy also consists of this. Antibiotic also is chemotherapy. Don't think that chemotherapy सिर्फ cancer का treatment है, ये सिर्फ normal लोगों के लिए. For us, giving antibiotic to a patient is also a chemotherapy because it is completely curing the disease. Unlike treatment of NSAIDs like anti-diabetic drugs, anti-hypertensive drugs, etc. ठीक है? So फिर से आते हैं recapitulate करते हैं. Stimulation means action by N. Stimulation means action by N. हाँ? Stimulation means action by N. Stimulation means action by N. तुमने तो आंसर दिया था. You gave the answer only. Agonist. खुद का आंसर कैसे पूछेगा? Depression or inhibition by N. Antagonist. Replacement. Example. जल्दी. Okay, fine. Irritation by absolute alcohol, for example, और भी बहुत सारे हैं, वो बाद में आता रहेगा. And cytotoxic means any kind of chemotherapy. It may be antibiotics or cancer chemotherapy. Okay, ठीक है. इसी चीज को थोड़ा सा डिटेल्स पे लिखना है. If anyone feels any kind of confusion, that's how to make a notes on the principles of drug action. Please post in the group. I'll give a word file. Okay, for you. Next point, mechanism of drug action. Actually, every drug has a detailed mechanism of action, so those will be discussed in the systemic chapters. In general, if you want to say that the drug action, mechanism of drug action means how the drug is acting towards its desired action. Okay? So it may be receptor mediated or it may be non-receptor mediated. Okay? Now receptor mediated चीज तो सिंपल है. सेल है, यहाँ पे रिसेप्टर है, यहाँ पे हो सकता है, यहाँ पे हो सकता है. रिसेप्टर है, drug will go and bind there, and that drug will exercise action on that very receptor. Okay? Now non-receptor mediated action क्या है? एक तो हो गया अभी जो बोला फिजिकल प्रॉपर्टी, जैसे एंटासिड हो गया तुम्हारा, और भी बहुत सारे. I'll just show in the next slide. Apart from this, what could be? In the cell or cell membrane, what is there? There are various ion channels, which are not exactly receptor, but there are various ion channels which controls the electricity gradient between the extracellular site and the intracellular site. Number one. Number two, inside the cell there are various enzymes. An enzyme is not a receptor, it's just a broad chemical. Which enzyme का काम क्या होता है? What is the function of an enzyme? Just to help the reaction to happen, right? It does not causes any reaction itself, but it just help the, means simple chemical word, this is a catalyst. At the normal situation, it is neutral, but on certain conditions, it works. It helps the various reactions to happen. So there are many drugs which helps these enzymes. It stimulates or it depresses. Okay. Now, action mediated by physical property. There are certain examples which is important. At least 4-5 याद रख देना. Because if short note comes in this format, that mentions some non-receptor mediated mechanism of action of drugs. So their marks will be 5 or 6, and you need something to write. Okay. So first is bulk laxatives. इसबगोल का नाम सुने हो कोई? क्या है वो? किस देखा था? सॉरी, जोर से बोलना यार, क्या है? हाँ, नहीं, किस काम के लिए यूज करते हैं? Constipation. Simple बोलना. घुमा रहा है तो यार. Good. It's actually small powders. Okay. You have to mix it with water. A significant amount of water. Suppose इसबगोल का पाउडर किसी ने डायरेक्टली खा लिया, क्या हो सकता है? इसबगोल खाने से कॉन्स्टिपेशन नहीं होगा, वो कॉन्स्टिपेशन का ट्रीटमेंट पे यूज होता है. डायरेक्ट अगर खा लिया, सपोज थोड़ा बहुत ही खा लिया डायरेक्टली चम्मच से, चलो खा के देखते हैं टेस्ट कैसा है इसका. ऐसे टेस्ट बहुत गंदा है. इट विल जस्ट स्टक टू योर थ्रोट. चोकिंग होने के बहुत हाई चांस है. क्यों? बिकॉज दिस एक्चुअली कॉन्टेन्स वेरी हाई अमाउंट ऑफ फाइबर्स. और फाइबर्स क्या करता है? फाइबर्स इट विल engulf water and it will stirs up. Basically, this is the function only. You will mix with water and you will drink it, and when you go inside the stomach or intestine, it will make a bulk, and that will help in evacuation. Simple logic. Okay. So we call this group of drugs as bulk laxatives. We have an entire unit for their GIT. So that constipation and diarrhea treatment is a very important chapter. Then para-aminobenzoic acid. Girls, every sunscreen what you use, para-aminobenzoic acid will be there because it's very efficient chemical to absorb UV radiation. Okay. Next comes activated charcoal. Did you come across? Activated charcoal. Yeah, face wash. Good. More importantly, in medical terms, it is a very important chemical or molecule which is used for the treatment of poisoning. पॉइजनिंग का फर्स्ट थिंग क्या होता है, ये एक्स्ट्रा जो पॉइजन है उसको बॉडी से निकालो, करेक्ट। अब एक्स्ट्रा बॉडी से अभी कोई निकल ली है, क्या करोगे, पेट काटोगे, क्या करोगे, हमेशा चारकोल नहीं, मतलब क्या करोगे, व्हाट द प्रोसेस नोन एज, एनी आइडिया? डिटॉक्सिफिकेशन तो ठीक है, द एंटायर थिंग इज डिटॉक्सिफिकेशन, यू कैन यूज एंटीडोट, यू कैन यूज हीमोडायलिसिस, बट मोर बेसिकली फर्स्टली तुम्हारे पास कोई पेशेंट आ गया कि कुछ निकल लिए, राइट, तब तुम क्या करोगे? Have you seen any case like that ever? नाक से क्या डालते हैं? We do gastric lavage. Gastric lavage means what we do? Here we take a silicone or polyethylene tube, which is known as Wright's tube. We put it from the nose to the stomach. We put water, a significant amount of water, then we pull it up. In simple word, in layman word, this is known as stomach wash. तो क्या करते हैं, जो अनएब्जॉर्ब पोर्शन ऑफ द पॉइजन है वो निकल जाएगा. टू डू इट मोर efficiently, sometimes we mix activated charcoal. Now activated charcoal is what? This is actually charcoal only, but it contains lots of small pores. It's a molecular size of pores. Okay. So as a result, what will happen? In the pores, it will absorb. The term is adsorb. ADSORB. It will absorb the excess toxic chemicals. So the gastric lavage becomes more efficient. The simple water से जो जितना निकलता, if we use activated charcoal, it causes more absorption of these chemicals. Okay. Number one. Number two, activated charcoal, it also has a little bit of oxidizing property. So in case of certain poisoning where oxidation actually neutralizes that poison, so it can help in that. Then again antacids, neutralization of gastric acid. Then chelating agent. What is chelating agent? We'll discuss it बहुत बाद में, एकदम लास्ट पे आएगा ये. Heavy metal example, lead, mercury, arsenic, etc. Okay. So basically those heavy metal salts, they are very little dissolvable in water. Okay. So as a result क्या होता है कि वो किडनी से वो यूरिन के साथ निकल नहीं पाता. ठीक है. Now in case of acute or chronic heavy metal poisoning, जैसे anyone from West Bengal here? Okay. तो arsenic poisoning से ना ट्यूबवेल के पानी से. It's actually once upon a time it was very common in West Bengal when we were in school kids. Almost 70% of the tubewell water it contains arsenic, particularly in the area of I think Sundarban in the area of Sundarban, means North Chobbish Pargana. So in that district there is a ample arsenic in the water, so there was a heavy number of poisoning cases. Acute भी होता है. So in forensic that will be discussed in details, that what those heavy metal poisoning does. But basically those chelating agents, what it does, it actually attracts those heavy metals and form highly water soluble compounds. तो यूरिन के साथ आराम से निकल जाता है. ठीक है, just helping the heavy metals to be excreted. Because those are such things which won't be excreted by hemodialysis as well. ठीक है. Then we have a drug named as cholesterol. Okay, this is a bile-acid sequestrating agent. Now people suffer from dyslipidemia. Like people like me who loves to eat too much, so they will suffer more. अब क्या करें? We have good cholesterol and bad cholesterol. Idea है? Which one is good cholesterol? HDL. And which one is bad cholesterol? LDL. Cholesterol itself is a bad cholesterol, isn't it? क्या करेगा वो? It will make a layer on the vascular endothelium, and as a result, what will happen? Dil ka daurad, right? So to save the patient from that, we use certain drugs which reduces the bad cholesterol, and to some extent it increases the good cholesterol. So among them, cholestyramine also is an agent. What it does, it actually binds the bile acids, okay, and make it water soluble. Basically, bile salts itself is not water soluble. I think in biochemistry you have done it, isn't it? So bile salt itself is not water soluble, but by binding with cholestyramine, it becomes water soluble and it gets excreted. So if there is less bile salt, what will happen? If there is less bile salt, what will happen? Bile salt का काम क्या होता है? फैट का एब्जॉर्प्शन. अब बाइल सॉल्ट का मतलब फैट का एब्जॉर्प्शन होगा नहीं, वो ऐसे निकल जाएगा. ठीक है. So in this way we are reducing the fat content of inside the blood so that LDL cholesterol, the synthesis of LDL cholesterol and triglycerides and all that reduces, and by reflex HDL cholesterol will increase. That's the basic mechanism. By which enzyme? What is the rate limiting enzyme in lipid metabolism? Biochemistry? HMG-CoA reductase. So we have a very important group of drugs, HMG-CoA reductase inhibitor. एक नाम लिख के रख सकते हो. That is all statins. Okay, we'll discuss it later. Then potassium permanganate, by its oxidizing property, it oxidizes many poisons to neutralize it. And in the gastric lavage fluid, sometimes we use potassium permanganate as well. I said first bench पे बैठ के सोना मत. And Mesna. Now, in case of bladder carcinoma, we have a very popular drug known as cyclophosphamide. Urinary bladder carcinoma होता है, तो we have a drug known as cyclophosphamide. This is a cytotoxic agent. क्या करेगा वो? It will destroy the DNA of the cells. Now, it will destroy the DNA of the cells which are very fast, which are very highly replicating. अब बॉडी में कौन सा सेल ज़्यादा replicating होगा? Obviously cancer cells. Because उसका, that's why they are called cancer cells, because their replication is more than the normal body cells. Okay. So हम लोग क्या करते हैं कि हम लोग directly bladder पे intubate करते हैं, then we flush out with cyclophosphamide. Now cyclophosphamide ज़्यादा देने से क्या होता है कि locally sulfhydryl chemical, that is SH. इतना केमिस्ट्री आई थिंक सबको याद है. Okay. So that sulfhydryl chemical itself is carcinogenic. Okay. So to prevent that sulfhydryl chemical to form, we use Mesna. So ये क्या करता है? Have you heard the name free radical scavenging activity? So what it does, it actually engulfs all those ionic chemicals like oxygen radical हो गया, sulfhydryl radical हो गया. So वो bind करके इसको neutralize करते हैं. The same thing done by Mesna. That's why we always use Mesna if we want to inject cyclophosphamide into the urinary bladder. So that will occupy the sulfhydryl radicals so that its carcinogenic property is inhibited. ठीक है. Then आते receptor mediated, और बाकी जो mechanisms है non receptor mediated, these are actually a little bit complicated. So एक दिन में ज़्यादा डोज देना सही नहीं होगा तुम लोगों पर, दिमाग में चोट पड़ सकती है, बेहोश भी हो सकते हो. तो simple में आते हैं, because receptor is actually important, and this will be just a simple basic discussion about that. Because receptor is a very big chapter. Okay. So basically, what are the receptor definition? Remember this, memorize this very nicely. Okay. That serves to recognize the signal molecule or drug and initiate the response to it, but itself has no other action. Point number one. What is it structurally? It may be a macromolecule or a binding site, anything. कोई structure हो भी सकता है, नहीं भी हो सकता है. Okay, but it is a place where an chemical or drug, chemical in the field of physiology or biochemistry, in our field this is drug, which comes and binds, causes some response. Whenever any molecule binds to a receptor, Every receptor have an affinity to a particular chemical. Okay. जैसे in case of after few days we'll start ANS. What is the full form of ANS? Autonomic nervous system. Okay. So we have basically two types of receptor family. That is, one is cholinergic and one is adrenergic. In physiology, you must have come across in the term of parasympathetic and sympathetic, isn't it? Sympathetic and parasympathetic. So this cholinergic system is parasympathetic and adrenergic system is sympathetic. But obviously there is overlapping is there. But basically this is the main structure. Okay. So in this regard, we have, let's say, parasympathetic system or cholinergic system. Okay. We have a chemical that is acetylcholine, right? We have a chemical known as acetylcholine. So acetylcholine क्या करता है? Acetylcholine जाके bind होगा कोई भी cholinergic receptor के ऊपर. Every cholinergic receptor has a specific binding site for acetylcholine. Similarly, adrenergic system will have binding site for those chemicals and all. Okay. So again, it's a macromolecule or binding site. Where it can reside? It may reside on the surface or inside the effector cell. It never resides on outside the cell. It has to be on this or here or here. On the cell membrane, maybe inside the cell, that is cytoplasm, or inside the nucleus. Okay? We have names also for that. So effector cell means the cell which will contain the receptor and the cell which is responsible for the action of that drug or chemical. जैसे यहाँ पे cholinergic system के लिए ऐसे नोड हो गया. This is also a cell. Okay. So it serves to recognize the signal, molecule or drug and initiate a response to it. But until and unless any chemical or drug binds to that receptor, it does not do anything. कुछ भी नहीं करता. चुपचाप बैठा रहेगा. Whenever anything will bind to the effector site, then only it will cause some effect. Now, what is this chemical known as, which causes the receptor to act or modulate the action of the receptor? Ligand. सब भूल गया. First year खत्म. Biochemistry, physiology खत्म. ऐसा नहीं होना है. Pharma याद रखना है. Medicine तक जिंदगी भर काम आएगा. Don't forget pharmacology. Okay. Now, some important definitions. We have certain terms: agonist, antagonist, partial agonist, reverse agonist, ligand, effect, action, blah blah blah. बहुत कुछ है, ठीक है? So, firstly, the most important term, agonist. What is this? Anyone please read? Raise your hand. Who will read? Please stand up and read loud. जल्दी class का time खत्म हो रहा है. Agonist is an agent which activates a receptor to produce an effect similar to that of the physiological signal molecule. पुराना वाला example लेके चलते हैं. Acetylcholine. Take acetylcholine and say muscarinic receptor. Now, cholinergic receptors, there are two types: muscarinic and nicotinic. Okay. So let's say muscarinic. अब muscarinic होता है बहुत जगह पे, but अभी सबसे prominent effect होता है heart के ऊपर. Okay. So heart को लेके चलते हैं. Acetylcholine, whenever it will bind to the muscarinic receptor over the heart, that is, let's say SNO, it will decrease the heart rate. What happens when you feel severe hypersensitivity? Your BP lowers down, right? So that BP lowers down initially happens because of severe bradycardia. Now, allergy होने से क्या होता है usually? Tachycardia होता है ना? होता है तो? Heart rate increase होता है तो? But there is actually reflex tachycardia. Initially, there is severe bradycardia. Okay. So because of that severe bradycardia, this is the usual effect of acetylcholine, which is the physiological ligand for M receptors. Okay. Now, if we have certain drugs which act on the M receptors to reduce the heart rate, that will be its agonist. Okay. अब एगोनिस्ट के बाद आएगा एंटागोनिस्ट. अब एंटागोनिस्ट क्या बोला था मैंने? एनीवन प्लीज अगेन स्टैंड अप एंड रीड. एनीबॉडी? अरे यहाँ से पढ़ने के लिए बोल रहा हूँ, डरने का क्या जरूरत है? कोई भी पढ़ सकते. रोल नंबर 26, मुझे पता नहीं है कौन कौन सा रोल नंबर है, मैं ऐसे रैंडमली 10, ओके मिल गया.
Antagonist, an agent which prevents the action of an agonist on a receptor or the subsequent response, but does not have any effect on its own.
Yes, thank you. What do you get from this? It's already explained before, right? At the first class introduction. Antagonist, it binds to a site which is designated for the agonist, or it may not be designated for the agonist. Okay. Now, यहाँ पे थोड़ा confusion, right? ये 2 क्लास के बाद दूर होगा. And it stops the receptor to do anything. ना इसका कोई function है, ना ये receptor का कोई function करने देगा, because it's already stopping an agonist to bind out. Now, when a receptor works, does any receptor has any action on its own? আমি এখন তোমাদের ফোন করতে আসলাম. Does any receptor has action of its own? No. It will have any action if any agonist will bind to a receptor, right? Now, अब antagonist bind हो गया receptor के साथ, and it's stopping an agonist to bind with that receptor by blocking the site or by some other mechanism. So, will a receptor will do anything? No, because antagonist has no action of its own. Correct? That is the function of an antagonist. Now, again, another thing comes out: inverse agonist. Sorry. Thank you. यहां से तुमको क्या समझ में आया? An inverse agonist, it has an action. Unlike antagonist, जो कुछ नहीं ना खुद करेगा ना करने देगा. But inverse agonist itself will do something. There is the opposite to its action. This is what does this benzodiazepine receptors do? They actually CNS depressant. It will induce sleep. Okay. Then it will. There are basic function अभी के लिए induce sleep time, ठीक है. तो beta carbon that is actually CNS stimulant, not by antagonizing the effect of benzodiazepine receptors, but causing the receptor to act in the opposite direction. That is the basic difference between an antagonist and an inverse agonist. अगर तुम physiological response पे जाओ, तो physiological output same होगा. But the mechanism of that physiological output is different. क्या बोला था? Every physiological system has a balance. Okay. Now, if an antagonist is blocking this side balance, so obviously that side will do more. Okay. Inverse agonist यहाँ पे कुछ नहीं करेगा, ये इसको ही बता देगा. तो effect तो ऐसा ही हो रहा है, right? Balance is changing, but the changing is in the opposite direction. क्लियर है या नहीं? अभी तक क्लियर नहीं है. प्लीज बी स्पेसिफिक. इज इट क्लियर? इज इट क्लियर और इज इट नॉट क्लियर? चलो बाइबल में तो आएगा ये सब, देखते हैं हाउ मच इट इज क्लियर. देन पार्शियल एगोनिस्ट. दिस एक्चुअली हैपेंस इन केस ऑफ सर्टेन ओपियोइड ड्रग्स. ओके, जैसे हम लोग कुछ डी एडिक्शन के लिए यूज करते हैं कुछ ड्रग्स, ओपियोइड डी एडिक्शन के लिए. सो दे आर मोस्ट कॉमन एग्जांपल ऑफ पार्शियल एगोनिस्ट. नाउ देयर इज अ टर्म नोन एज मैक्सिमल रिस्पॉन्स एंड सब मैक्सिमल रिस्पॉन्स. लेट मी राइट दैट. Is it clear? समझ में आ रहा है हैंडराइटिंग? मैक्सिमल एंड सब मैक्सिमल. देखो, every time in our body there is a certain number of receptors. Okay. So in a particular dose, it's not like that all the receptor will start its action. सपोज बॉडी पे 100 रिसेप्टर्स है, कोई भी सेल पे या कोई भी ऑर्गन पे 100 रिसेप्टर है मान के चलो। अब हम लोगों ने कुछ मेडिसिन दिया, तो वो रिसेप्टर 30 या 40 रिसेप्टर के ऊपर बाइंड हो गया, उतना सारा ड्रग के ऊपर, बट बाकी सारे फ्री। तो जो 30 रिसेप्टर के ऊपर बाइंड हुआ, 30 लेके चलते, वो 30 रिसेप्टर क्या करेगा? इफ इट इज एन फुल एगोनिस्ट और एगोनिस्ट, वो 30 रिसेप्टर पूरा काम करेगा, ठीक है। दिस इज नोन एज मैक्सिमल रिस्पॉन्स। अब डोज बड़ा हो गया, सो 30 के जगह पे 60 पे लग गया, और बड़ा हो गया तो 60 की जगह पे 100 पे लग गया। तो द फिजियोलॉजिकल रिस्पॉन्स दैट विल बी मोर, बट इफ एन एगोनिस्ट बाइंड टू रिसेप्टर, दैट सिंगल रिसेप्टर विल वर्क्स टू इट्स फुल एफिकेसी। जितना उससे काम हो सकता है वो पूरा कर लेगा, ठीक है। सो दैट इज डन बाय एन एगोनिस्ट। नाउ इफ इट इज अ पार्शियल एगोनिस्ट, वो रिसेप्टर फुल काम नहीं कर पाएगा, से अराउंड 10% या 20% काम करेगा। दैट इज द फंडा ऑफ डी एडिक्शन थेरेपी। ना होता क्या है कि सपोज कोई पेशेंट से कोकेन ले रहा है, ठीक है, सडनली अगर स्टॉप करेगा तो उसका मेटाबॉलिज्म इफेक्ट होगा। तो हम लोग क्या करते हैं कि उसको कोई एक ड्रग देते हैं जो कोकेन की तरह काम करता है, बट पूरा कोकेन की जैसा इफेक्ट उसका नहीं है। दैट विल एक्ट ऑन द ओपियोइड रिसेप्टर्स बट विल कॉज सबमैक्सिमल एफिकेसी, ठीक है। सो पेशेंट को इफेक्ट होगा, his physiological function that won't compromise because the brain and the body is feeling that okay मुझे तो ओपियम मिल रहा है, but the effect या जो सिंपल सी बात करते हैं, जो नशा जो हो रहा है, that won't happen to its max। सो धीरे धीरे ये फिजियोलॉजिकल रिस्पॉन्स कम होकर साइकोलॉजिकल पे रहेगा और पेशेंट को तो नशा तो हो नहीं रहा है। सो बाय दैट टाइम काउंसलिंग एंड अदर फैक्टर्स वी कैन टेक अप द पेशेंट फ्रॉम इट्स एडिक्टिव फेज। Now that treatment protocol becomes a very successful nowadays, and we call it replacement therapy, replacement de-addiction therapy, ठीक है। So that is the point where partial agonist comes into an act, that an agent which activates a receptor to produce a submaximal response but antagonizes the action of a full agonist। अब ये कैसे हो रहा है? ये हो गया तुम्हारा रिसेप्टर, ठीक है। ये क्या है? दिस ब्रेक बाइंडिंग साइट। यहाँ पे आके एगोनिस्ट, पार्शियल एगोनिस्ट, एंटागोनिस्ट, पार्शियल एगोनिस्ट सब आके मिलेगा। Now to an agonist to act upon, one receptor has only one side for the agonist, okay। तो जब तक यहाँ पे आके नहीं लगता है तब तक एगोनिस्ट काम नहीं करेगा, मीन्स द रिसेप्टर वोंट वर्क एनीथिंग। नाउ इन केस ऑफ ए पार्शियल एगोनिस्ट, इट विल बाइंड हियर ओनली, and after an agonist bind here, the place is क्या? अब तुम यहाँ पे बैठो, यहाँ पे पार्टिकल इसी जगह पे कोई और बैठ सकता है? कोई भी नहीं। So that part is occupied. So agonist won't be able to, अगर हम लोग दे भी दिए तो भी agonist यहाँ पे bind कर नहीं पाएगा। Okay. So as a result, what will happen? It's stopping the agonist to work. What does it mean? This is actually acting as an antagonist. But we can't call it an antagonist because it's causing some effect to the receptor. Antagonist का definition क्या है? It does not have any effect on its own. ये कुछ नहीं करता. Nothing means nothing, 0%. But partial agonist will work. At least 5% होने से भी कुछ करेगा. So we can't call it an antagonist. This is a partial agonist, but it is also acting as an antagonist itself. So that is the definition comes that an agent which activates a receptor to produce a submaximal response but antagonizes the effect of a full agonist, ठीक है। Now finally ligand, any molecule can be drug, hormone, anything can, any ion, chemical, anything which attaches selectively to a particular receptor or sites। बस यहाँ पे रुक जाओ, काम करता है कि नहीं बोलने की जरूरत नहीं, बिकॉज एगोनिस्ट are also a ligand, antagonist is also a ligand, inverse agonist is also a ligand, partial agonist is also a ligand. Anything which attaches selectively to a particular receptor or sites, that is a ligand. Works or does not work, stop it. Clear? Hopefully this much is clear. Sure.